We got Lady in Red in the corner. Love it, Dr. Kohli. She's here to answer all our questions about these new COVID booster shots that just got approved by both the FDA and the CDC.
Let's jump right in, shall we?
That was the weirdest turn.
I know, Sam just like stopped.
It was like you were like one of like those CD players from the 90s. You just stopped talking. And I was like, are we still on the air?
I'm told that Jeff has a question he wants to get to, so I'm going to honor that, Jeff.
Okay.
Honor that? All right. Wow, we're very professional here on Friday. So I better look right at the camera. So Dr. Kohli, these new booster shots are not without controversy. They're only tested in mice and Tori, and not humans. So talk to us about these boosters. Are they safe and effective?
You know, I'm glad you're asking me this, Jeff, because you've had a lot of questions about the vaccines all along. So I think coming from you, this is a really appropriate question.
But I'm double vaxxed.
Double vax.
And boosted.
And boosted.
And boosted.
Okay, and now you're going to go and get this booster after I'm done talking to you today, right?
Well, let's see what you have to say.
Okay. So the FDA actually purposely told them not to test them in humans because they wanted to greenlight it, because we already have more than enough data on the fact that they're safe. This is something we've been doing for decades. We do this every year with the flu, switch out the messenger RNA or switch out the DNA in the vaccine and just put in a new one. So for every strain, we don't need to repeat the trial. So safety, I'm not worried about. Efficacy is a little bit more of a question mark. So how well do they actually work? Now, you know, this is a little bit of a different booster than the one we've had before, but mice data tells us that it's 20-fold more effective than the one we had before against protecting against symptomatic infection from Omicron.
Great.
Yeah,
Great.
so that was going to be my question. How are these different? So they're 20 times better? That's how they're different? That's a good thing to put on the outside of the box?
This is a software upgrade. It is a huge upgrade for our booster. So the old booster had only one virus strain in it.
That was the Windows 98 booster.
Yeah. The Excel version. Or Sam's old cell phone.
Yeah, exactly. Oh,
carries
Sam's
around.
old stuff.
So that was the Toyota of boosters.
Yeah.
This is the Tesla of boosters. Yeah.
Don't knock Toyota. They go forever.
I have a Prius. I love
I
it.
rock
So that
those.
was
She
very
drives a
good.
Tesla.
Oh, okay. Good plug.
So Toyotas are great. They're reliable. They work. But going faster with a Tesla, if you upgrade, and that's what we've done here. So instead of having just that one strain, which is the original one, we have that, plus we have, you know, the Omicron BA4 and 5, and that really allows for a higher level of antibody response, as well as hopefully a longer duration and more general coverage.
Good analogy.
All right, how important is it to get these shots, considering the fact that you can still catch COVID after getting boosted? Tell me about that.
So with the old booster, that was the case. With this one, we're hoping it's 20 times better. It's your Tesla booster that's going to hopefully make it not only a lot less likely to catch it, but a lot less likely to get infected.
I'd like upgrades.
Me too. Well, what should we do? Me too.
Right.
What should we do about our kids? And now I know a lot of our viewers either have grandkids or kids, and they're wondering, just like we are, like for my kids, they're both eligible right now to get their COVID vaccine. And I've been talking to you about which one should they get. Should they wait until a new upgraded version comes, or get in there now and then go get boosted later? What do we do?
You have to get the basic one. You have to get those 2 doses before you're eligible for this upgrade. So you have to put in your Toyota time before you're eligible for a Tesla. But the boosters, the upgraded boosters for kids are coming. So that'll be the next iteration. But you guys all need to go get your boosters, because anyone, regardless of their risk, regardless of whether they've had the infection, if they're at least 3 months out from their infection and at least 2 months out from their last shot, need to go and get a booster before the fall wave hits.
What about when we get our flu shot? Can we get both at the same time?
That's what I'm going to do.
Oh.
Okay.
Yeah. In fact, I think we should have a little party. What do you guys think?
Shot and a shot.
I don't go to parties with needles. But you know, I did want to ask you.
Those are all the parties that I go to.
That's true. That's true. So, you know, so if somebody's watching or myself, we log on to our healthcare provider and we say, I want to go get a booster. Is the Tesla booster available? Is that the one we're going to get today?
I want to wait for the
when
Tesla
is it coming
booster.
out?
Labor Day. So the CDC
really?
and
It's like a
FDA have
sale.
greenlighted it. They already, that's right. It's like a
Is
sale.
everybody eligible?
Everybody's eligible for at least 2 months out from your last shot, or at least 3 months out from your infection.
Well, what if you got infected and you don't know? Is it bad then to go get a booster?
No, not at all. It may not do much because you already have the protection
won't
from
hurt.
the infection. It won't hurt.
What about the saying you're not allowed to get boosters after Labor Day? Is that relevant? No, I'm just kidding. Let me sneak in this last question. A new survey is out, and it showed that 2 in 3 adults don't know their blood type. I don't even know mine, and I've been looking for it. How important it is to know something like this, and does it have anything to do with? I've never gotten the virus, COVID. I forgot about what it was. That's a good thing.
And how do we find out our blood type?
Yeah.
So blood test, easy to know. Every single person should know it. In fact, put it in the back of your driver's license or something. If you're ever in a car accident, people need to know your blood type.
Oh, no,
if you have a loved one
guys.
who's in a car accident, you need to be a donor, you need to know your blood type. So I would say, and I'm disappointed, honestly, because I asked the producers a while ago, nobody knows it. Go and find out.
We need
what
to
your
find
blood
out.
type
Now,
is.
you just sent me to go get my blood work done. Can I call them and they'll tell me?
It has to be a special test. So you have to do a blood type. It's called
Can
a
I sneak
type
in
and
something
screen.
very, very important? A friend of mine, his aunt needs O negative. I know it's difficult to find. So if anybody watching has O negative, please reach out to DBL. That just
that's
hit me. Yeah, sorry about
wonderful.
O negative. I guess it's real. They can donate to everybody,
Universal
but they can,
donor.
but they
Universal
can't. They can only take O negative, right? So it's hard to find. So
Good to know.
if anybody watching is O negative, please, good lady.
Wow. Please reach out to DBL. Thank you so much, Dr. Kohli. We appreciate you as always.